Our next PowerPoint is Dental Diagnostic Emergency and Health Information Services in Careers. So a dental career, of course, you know, a dental career, they work on our teeth. They work on the soft tissues in our mouth, okay? Their job, the dental profession, is meant to prevent dental disease, repair diseased or damaged tissues, and treat the gingiva, which is our gums. A dentist can either be a DMD or a DDS, which is a DMD, Doctor of Medicine in Dentistry, or DDS, Doctor of Dental Surgery. So the dentist, you know what the dentist does. They examine your teeth, your soft tissues in your mouth. They diagnose and treat disease. They can perform surgery, oral surgery. They supervise the other workers in their office, and most of them are entrepreneurs because most of them own their own practices, their own dentist office. And a dentist is required to be licensed. He cannot practice dentistry without a license. A dental hygienist. The hygienist works under the supervision of that dentist, and they clean your teeth. That's what I need for you to remember. Your hygienist, if you think of hygiene, clean, they clean your teeth, okay? They can also take and develop x-rays. Most of them have a 2-year degree, and they are also required to have a license to practice. Dental laboratory technician, they work under the orders of the dentist, and they have a 2-year degree. Some of them have some on-the-job training, and they usually make prostheses like dentures, crowns, bridges that you have to have put in your mouth. A dental assistant also works under the supervision of a dentist. They usually prepare patients for exams. They pass instruments during procedures if the dentist is doing a dental surgery. They can also take and develop x-rays. They can sterilize instruments. And the dental assistant usually has like a 9-month to a 2-year degree. They have lots of on-the-job training again, and they are required to have a license or certification. Now, diagnostic services, that is where the word diagnosis or diagnostic is finding out what's wrong with you. What is your diagnosis? If you're having a hard time breathing, you're coughing real bad, you're running a fever, you go to the doctor, get a chest x-ray, and you have pneumonia. Your diagnosis is pneumonia. Okay, diagnosis just means what is wrong with you. So diagnostic services, they perform tests and evaluations that help the doctor to detect what's wrong, diagnose and say this is what it is, and treat that disease. A medical laboratory technologist, they work under the supervision of a pathologist. Now that pathologist we're going to go over, he's a medical doctor that has specialized in pathology. And path is disease, so ologist is specialist. So he is a specialist in diseases. He works in a lab typically and helps the doctor, the medical doctor that's ordered tests, determine what's wrong with you. Like the pathologist is the one that will look under the microscope at a biopsy that the doctor took and tell if it's cancer cells or not. Okay, so that medical laboratory technologist works under that pathologist in the lab. They study tissues, fluids, and cells to help determine the presence or cause of disease. They perform very complicated tests in the lab, microscopic tests, okay? A phlebotomist draws blood. That's what the phlebotomist does. Typically, they go around and they draw all the lab work and draw the blood that the patient needs at the hospital. Once they get back to the lab with it, they actually can help the lab technician, get it ready for testing. But phlebotomist, I need for you to remember, draws blood. And they have like a 10 to 20 hour certification to do phlebotomy. Radiologic Technologist, or an x-ray tech. They work under the supervision of a radiologist. Now that radiologist is a medical doctor, just like that pathologist, just like that family practice, just like that cardiologist, but they specialized in radiology. They specialized in reading x-rays, okay? And that is very difficult. But the radiologic technologist takes the x-rays, Okay? They're not going to read them. That doctor, the radiologist, has to read the x-rays. So that radiologic technologist will take x-rays, they do radiation therapy, they do your ultrasounds, your CAT scans, your MRIs, things like that. Now, epidemiologists right now are pretty hopping because of COVID-19. That epidemiologist is a medical doctor who has specialized in epidemiology, which is tracking diseases in populations of people, like an epidemic or a pandemic. Okay, so that epidemiologist identifies and tracks diseases as they occur in groups of people. They also are trying to develop ways that we can prevent the spread of infection. And they evaluate statistics and data that deal with epidemics and other health issues. Like right now, the big thing is the 3 W's. Wear a mask, wait 6 feet apart from everyone, and wash your hands. That's the big thing right now with the COVID-19 and any other flu season, anything like that. A biomedical engineer. They're an engineer. They create things, but they do it on the healthcare side instead of like being in a factory and creating and engineering a program or engineering a machine in a facility like a manufacturing plant. They actually develop devices that help diagnose and treat disease, like artificial organs, artificial hip replacements, heart valves, an artificial heart. There is a Jarvik artificial heart. They also design computer programs, monitors, x-ray machines, surgical instruments, lasers. The biomedical engineer is the one that created the Da Vinci robot that does robotic surgery. So anything from computer programming to the actual equipment itself to devices that are implanted into a human's body, that biomedical engineer is responsible for developing those. Now, we're going to talk about skills, and it says skill, height, and weight. There's a few things that we're just going to talk about real quick. If you are weighing a patient, it seems pretty easy, just jump on the scales, but there's a process. So you've got to make sure you've got your upright scale, that you've got a notepad, pen, of course, because you're writing stuff down. So you're going to greet your patient, tell them who you are. Hey, my name's Amy. I'm going to get your weight right quick. Tell them what you're doing, of course. And it says wash your hands. In healthcare, anything you do, you want to wash your hands before and after. So first thing, you're going to make sure if your scale is not a digital scale, if it's the old-timey slide the little weight back and forth, you're going to make sure that your scale is balanced, because if it's not balanced, it's not going to give you an accurate weight, okay? So you're going to take their shoes, have them take their shoes off. If they've got big, heavy shoes on, of course, they've got flip-flops on. You don't have to do that. Big, heavy clothing, sweaters, things like that. You need to take that off because it's not going to be an accurate weight if you don't. And it says raise the height rod. While you're standing on the scale, you can actually measure a patient's height. So put the scale on what the patient says they weigh and then adjust it to make sure that it's balanced and you're getting a correct weight. Of course, you're going to write it down. Then you're going to, if you're getting the height for your patient, you're going to just lower that bar to where it's just barely touching the top of the patient's head, and you're going to record that in inches, and it'll show you how to do that on that on the scale. But the big thing that I need for you to come away with your skill of height and weight is the most important thing while weighing a patient is to make sure that your scale is balanced, because if you're not starting off with a balanced scale, it's not going to be a correct weight, okay? And then you're just going to put it in the patient's chart and, of course, wash your hands. Now, emergency medical services, that is EMS, emergency medical services. They're the folks that are on our ambulances. They provide emergency pre-hospital care for victims of accidents, injuries, or sudden illnesses. They can also be entrepreneurs because some of those ambulance companies are private and they're owned by individuals. We think of our county-supported EMS, but some of them are owned privately, like private transport companies. Now, emergency medical services have various levels of their program, and we're going to go over those. Emergency medical technician, ambulance, basic. Basic means that's all they do, basic things. They administer initial treatment. They give treatment for shock, burns, bleeding, things like that. They provide basic life support. They can rescue people that are trapped in vehicles, okay? Now, when you're thinking basic, think that's the first step in that emergency medical technician job, okay? That's the first step. That's like the entry-level job. Then you're going to go up to the next level job, which is intermediate, and they can do a little more than the basic EMTs can do. They can assess patients, manage shock. They can interpret EKGs, which is electrocardiograms, and they can defibrillate, which is like shock the heart if it's in a crazy rhythm. And they can insert airways to help the patient breathe. Now, the next level is paramedic level. That is the highest level of an EMT. You've got basic, which is the lowest level. You've got intermediate, which is the middle level. And then you've got paramedic, which is your absolute highest level in emergency medical technicians. Now, of course, if you think pay-wise, who's going to get paid more, the paramedic or the basic? The paramedic, because they've got more training. So that paramedic can perform all the duties that basic paramedic or that basic EMT can do. They also can conduct in-depth patient assessments. They can provide advanced cardiac life support. They can interpret EKGs. They can actually give medications as permitted by law, meaning a paramedic can give medication if it is ordered by the emergency room doctor. Say they have standing orders or standing protocols. If a patient is doing this, then you can give them this medication. Okay, they can't just willy-nilly just say, oh, I think I'm going to give the patient this, because you have to have a medical license to prescribe medication to a patient. But if there's already predetermined algorithms that if this patient is doing this, then you give them this, and the medical doctor at the emergency department has signed off on that, then that paramedic can give those medications. But the paramedic's the only one that can give those medications, okay? Now we're going to talk about a bleeding skill. You're actually supposed to be in the classroom for all this stuff, but we're not. So the big thing that I need for you to know with a bleeding skill, if you come across somebody that's bleeding, use standard precautions. Wash your hands, put gloves on. Don't just run up to somebody and just start holding pressure on a wound, okay? Try to have a barrier between you and that person's blood, because you don't ever know what they have, okay? So the big thing is let them know who you are. You've got some gloves on, and you're going to, I'm here to help. And if they're bleeding, the biggest thing to do is just provide direct pressure. Put pressure on whatever is bleeding. If you've got gauze, a clean t-shirt, and you know what, a dirty t-shirt. If somebody's out there bleeding to death, I'd much rather have a dirty t-shirt on them trying to stop them from bleeding versus them bleeding out and dying, okay? So big thing, wear gloves. Let them know who you are, that you're there to help, and put some pressure on that wound. Now, are you going to lift that gauze or that t-shirt up every time, every couple of minutes and look to see if it stopped bleeding? No, you're going to leave it there. Don't lift it up. Wait till they get to the ER. The ER physician can do all that lifting. You're going to hold it there. The point of what you're doing by holding pressure is to hopefully start a clot forming. And if you lift it up, you've ruined that clot that you had started creating, and it's starting to bleed again. So you want to leave that pressure on that wound. Don't lift up the t-shirt or the gauze or whatever you've got, a towel. If it's bleeding through that, you're just going to add to it. You're not going to get rid of that one, what's on the wound. You're just going to add to it, okay? And of course, anytime you've done this, the last thing you're going to do is wash your hands. Okay, we've already talked about all that. We're not going to talk about a tourniquet and stuff like that, okay? Now, I'm going to stop right here, and this is going to be the part 1 of our PowerPoint, okay, because I'm not quite finished. So we'll start on part 2.